Welcome back. We want to take up a serious but very important subject. This is a vigil held last night in Pullman outside of Martin Stadium to honor WSU quarterback Tyler Hilinski. Students on campus coming together after he was found dead Tuesday. He had committed suicide. Police went to check on him after he didn't show up for a practice. He was just 21 and the projected starter for the football team next season.
You know, it's the kind of news that just sends a chill through every parent. It's all too common on college campuses, even high schools. And joining us now to talk a little bit more about what we should be looking for, what we can do, what we can say is Dr. Vanessa Casillas with Providence Health and Services is here. And oh my gosh, we don't know what happened with this wonderful young man, but I can tell you that, you know, his friends and no doubt his family never saw it coming, or they would have done something. What should we be looking for with our young people?
Yeah, and it's an important topic, so I'm glad we're talking about it. You know, common warning signs of suicide can include hopelessness, feeling trapped in a situation or like there's no way out, increased anxiety for people, agitation, change in mood swings, withdrawing from family and friends, talking about wanting to die or potentially feeling like a burden to other people in their life, giving things away, saying goodbye to people, increased engagement even in risky behaviors, things like drugs, alcohol, reckless driving. I think one challenging thing about warning signs is that they're not always obvious.
No, they're not.
And they can vary from person to person. So more than anything, just looking for a change in somebody's behavior.
Doctor, you know, when a story like this hits the news, I want to talk to my own children about them. You know, I have a sophomore in college, a son in high school, and two older children, and I want to bring it up, and then they were like, oh, Mom, don't worry. Should we have that conversation?
I would encourage people to, it's obviously a challenging topic to talk about for people on both sides of that conversation, but if we don't talk about it, then oftentimes we don't know what's happening for someone. So I'd encourage you to talk about it at home, to try and normalize talking about our thoughts and our feelings, how we're responding to things as a family. I think we can do that with people in our lives by modeling that behavior for them. If you do notice a change, I would encourage you to bring it up directly. You know, note that change that you've noticed to your loved one.
And say, I've noticed you're not texting me as much, or I haven't heard from you.
Exactly.
Anything, you know, what's going on.
I think that gives some helpful context to the situation. And I think it also opens the door for someone to say, there is something going on, and here's what it is, you know.
Is it different for boys? Because I know, you have a daughter, of course, but your sons, and I don't know if they're as open, are they?
You know, it's hard to say because I think it differs from person to person. But I think the more we can normalize this conversation, the more people will become comfortable with it. And I think if you do notice these specific warning signs, I would encourage folks to ask a very open but direct question about suicide. Are you thinking about killing yourself?
To just say that.
Yes, I would encourage you to.
Have you ever thought about that? Or
have you ever thought about that? I think it communicates to people that you're open to talking about it, that you care about them, that there's help available, without asking the question in sort of a leading or judgmental way if you're hoping they respond a certain way.
Well, that is very direct, and we thank you for confirming that. I mean, I feel like in my heart that's what I want to ask, very direct, but hearing a professional advise that helps out a lot.
Absolutely.
Thanks so much for coming by today. We
You're
appreciate
welcome.
it. And we do want to offer some phone numbers. You know, if you know someone contemplating, thinking of, who's talked about it, make sure these numbers are available, 1-800-273-TALK.
And you can even text, which I think is wonderful, right? Because a lot of kids will not pick up the phone these days for any reason except a text. So you can text to 839-863-273-TALK.
The National Suicide Prevention
They are there
Lifeline.
24 hours.